When I walk on by, girls be looking like Debbie Fly.
This is Udin,
And my new freak.
21-year-old, wild and carefree man, still young and single. Udin comes from a rich family and now stays alone in Kuala Lumpur. He spends almost every night clubbing in Zouk. Like there is no tomorrow, he enjoys the hell out of his life. Forgetting all of his worries of the cruel world, only a hand seduces him.
Abang bang jago, sorry bang jago, abang jago.
Udin woke up the next day in his room and continued to lead his life as normal. It's nothing new to him. But as days passed by, Udin started to develop a fever. At first, he thought the fever would eventually drop, but his fever prolonged. Then he started showing a few symptoms that began to worry him. He has rashes, he started to feel extreme tiredness. His tongue also started to have white spots. Feeling anxious with his symptoms, he rushes to the community clinic and starts to think.
Abang bang jago, sorry bang jago. Oh my god! Wow! Oh my god!
He then finally realized he had an unprotected sex that night, but deep down, Udin was confident that he wasn't having HIV. To reassure himself, he requested a rapid HIV test conducted by Dr. Hani. Dr. Hani started taking Udin's history of presenting illness. She then explained to him the rapid HIV test procedure before conducting it. 30 minutes after the test was conducted, Udin's rapid HIV test results came out indicating it was reactive. Dr. Hani successfully gained Udin's consent for the confirmation test of HIV, and the confirmation test was conducted. 2 weeks later,
Mr. Udin?
Ya saya. Okey. Assalamualaikum doktor. Boleh masuk lah?
Oh yes, Mr. Udin. You may have a seat, please.
Okey.
How are you for the past few weeks, Mr. Udin?
Well, so far I would say macam so-so lah. Macam sometimes sakit kan, macam ada sikit anxious, anxiety, migraine, sometimes tu just not that kind of big deal lah. So I'm still good with it. I can totally handle it. So far so good.
Do you want some water?
Oh, boleh doktor. Thank you doktor. Allah, kisahkan doktor je ya. Oh, I'm so sorry doctor. I accidentally drink all of your drinks and now it's empty, and I'm so sorry about that. I mean, there's a lot of this going on, and I just need some refreshment so that I can keep thinking straight.
I understand it's hard when we don't really know what to expect, Mr. Udin. You could take your time if you want. Yes, of course. I could wait for a while.
But no, doctor. It's okay. I'm totally calm. Totally chill.
Mr. Udin, as you could see, we called you earlier this morning because we do have your result. And Mr. Udin, I'm really sorry if it is shocking for you, but I do really need to tell you this. The HIV confirmatory test that we done, the result is positive. That means, Mr. Udin, you are infected with HIV virus.
a few moments later.
Do you want some tissue? Here you are.
I don't know what to expect, but it's too sudden for me. Macam, wow, HIV. Macam, I never thinking about contracting this kind of disease before.
Mr. Udin, you can tell me exactly how you feel, Mr. Udin. I'm all ears for you.
I feel dumb. I feel like I'm lost. I'm all alone. It was all my fault. To be honest, doctor, I feel like it's better if I just die, like right now.
I know that you are frustrated with this shocking news. But do not worry, Mr. Udin. I reassure you that there are so many ways to control the symptoms of your disease. You could lead a normal life like a normal people do.
Really, doctor?
Yes, HIV positive patient could still live like a normal people for quite a long time.
But doctor, I thought HIV leads to AIDS. How could I live longer if so?
Yes, HIV could lead to AIDS, but AIDS is like the end stage of HIV itself. We can slow down the progress of AIDS by giving you a recommended therapy. With this therapy, with this medication, you could still lead your life quite long time like normal people do.
Mean that there are therapy like that? You really mean it?
Oh yes, let me explain to you. Then, for a HIV positive patient, we recommend highly active antiretroviral therapy, which is known as HAART. HAART is a combination of functional drug that used to treat HIV patient, which can stop the virus from making its copies in the patient body. Do you know how it can help you, Mr. Udin?
No. Macam mana tu ya?
Okay, it's like this, Mr. Udin. HIV, human immunodeficiency virus, actually damage our body immune system by attacking our CD4 T cell. CD4 T cell is actually a functional cell in our body that used to fight the diseases. When the CD4 T cell is damaged or lower in the number, it could lead to chances of getting AIDS.
Yeah. Okay.
Therefore, with HAART, the drug could slow down the destruction of CD4 T cell and therefore would suppress you from getting AIDS. Actually, if you get early treatment, Mr. Udin, your chances of getting AIDS is low. As long as you don't reach the AIDS stage, you actually could lead a normal life like normal human being. Also, Mr. Udin, it is important for you to know about the prevention of transmitting the virus to the others, because it could spread. I will explain more on how to prevent the transmission of diseases for you.
A few moments later again, after Udin finally convinced and being comforted for his shock.
If I take this hard, how long I can survive?
Positive patient could lead a normal life like normal person do. Even with AIDS patient with HAART treatment, they could live like 10 years and more. But remember, Mr. Udin, you must comply with the medication. If not, the functional medication wouldn't suppress the AIDS. And with good compliance of HAART, you can prevent its transmission. It means undetectable is equal to untransmissible. That means the viral load or the virus in your bodies that couldn't be detected wouldn't be transmitted to the other people.
Alright, doctor. Okay. I'm sorry. Everything you just said, you just explained to me. I faham. Maybe I just need a little bit more time to digest all of these new things. But one thing for sure, I will make sure that I comply to this medication and bertaubat, insyaAllah.
Sure, Mr. Udin. I know you can go through this. Try take this thing slowly and steadily. You can still hang out with your friends and family, socialize like other people do. Like, For example, you can just shake hand and share your foods with your friends and family. Just know your boundaries. Right now, Mr. Udin, you just need a really strong support from your trusted one. Do you have anyone you could trust with to share this problem with?
I have a friend, and if possible, I want to keep this matter like secret from my family.
Yes, you can, Mr. Udin. Only sexual partner need to know, because HIV could easily transmitted through sexual transmission. Other than that, Mr. Udin, I believe you will be fine. You could always come for help and moral supports anytime you want.
God, thank you for your advice, doctor. I'll make sure that I follow all of your advices.
Okay, Mr. Udin.